Hi, we have just rolled over the top of the hour. I'm going to give everybody just another minute to get logged in, to kind of settle into our broadcast today. I am super excited to present to you some information provided to us by our outstanding partners at the Physician Assistant Education Association. We're going to start our webinar with this really awesome short video that's really talking about, kind of the pathway. That's really been a theme of ours this last season, is that there's a path for everybody. And so this is a PA path that you could choose to follow. When this video is over, we're going to be joined live by Heather Storm, who is one of the program managers, and she is outstanding. She works with students on the path to PA. She'll be here to answer your questions live. I'm really excited to have her join us. Right now, if you have questions or if questions come to you while you're watching the video, feel free to pop those into the chat. You can pop those into the question tab. And if you happen to be watching this as a recorded session after the live, you can absolutely still put your question into the little chat bubble, and we'll get that question when the session is over, and we'll get back to you. We'll have Heather reach out to you. We'll get somebody to answer your questions. So please don't hesitate to get your questions to us. So with that, I am excited to start our video.
Hi, I'm Alicia Bolden. I am a faculty member at the Duke PA program. I serve as a course lead for our PA practice in the health system. I also serve as a clinical coordinator. I've been a PA for 16 years. So I'll give you a little bit about my journey and my path. I'm an 80s baby. And for many folks, that may bring up nostalgia of fashion and music and videos. But for me, that brings up a tumultuous upbringing. My community and also my family was hit severely within the crack cocaine pandemic. Both of my parents were crack cocaine addicts. Wow, that's still hard to say after all this time. So it took a village to raise me. I remember distinctly there was one period where I maybe was in second grade and no one had arrived to school to pick me up. And I was told by the front desk administration to go to the library and await for someone to come and get me. They were trying to contact someone. And while I was in the library, I remember very clearly the librarian put me in a corner and said, "Here, take this book and read a book." And that was my aha moment. That was my introduction to reading and to books, and it became my escape. I began to use books to imagine a world outside of what I was seeing every day, to imagine a different path, imagine a different career, and imagine things that I did not see. I ended up doing very well in middle school and high school due to my love of reading and my interest in always learning. I graduated from high school with the help of a Grace advisor who sat down and helped me fill out college applications, and who also asked me what did I want to do. And at the time, I didn't know what I wanted to be. I know I wanted to be in medicine, but I didn't know how. I thought maybe nurse, maybe physician. That was the only thing that I had heard of. So I went off to UCF, which is a public school in South Florida or Central Florida, and with a scholarship. And I was the first in my family to go to college. I was the first in my family to graduate with a bachelor's degree. And during those 4 years, I got introduced to the PA profession. Luckily, at that university, our student health was staffed by PAs. And I remember going in for a random sort of a routine cough or cold symptoms, and I met the PA. And she talked to me about the profession. I'd never heard of the profession before. She allowed me to come back and shadow her. Being an avid reader, I read everything I could at that time about the profession. I did a lot of research, and I applied to PA school, and I was accepted into PA school. So then I became the first in my family to get a master's degree, and to also to have a professional career in medicine as a PA. My first PA job out of school was in urgent care, and I actually began to work in the community that I was raised in. Shortly after that, I was offered a job at the hospital that I was born in, and it was an indigent hospital, so it was typically for patients who did not have insurance or did not have any money to pay for medical services. So I became full circle. It was full circle for me to work at a hospital that I was born in, and serve the community that looked like me, that had lack of resources like me. And I worked at that hospital for about 6 years before I got into PA education. Because I realized when I was talking to folks about PA, a lot of the barriers was they didn't see anyone that looked like them at the application process into PA schools. They didn't see faculty that looked like them. They didn't see anyone that came from their background. They assumed that everyone that was a PA or had attended PA school had resources to be where they were. So I transitioned into education. It was one of the best decisions that I could have ever done. It brings so much fulfillment to recruit underrepresented students, to recruit students from low socioeconomic status, to recruit first in college generation type students, and to be that face, and to be that advocate, and to be that voice for them as they go through PA school. So here I am, a PAC, now a Doctor of Medical Science degree holding PAC. So now I'm the first in my family to have a doctorate degree doing the profession that I love, serving the communities that I love by churning out amazing students. And I like to say that I am no longer a statistic. I am a PAC. I was told no a lot. I was told that children from my environment, from my upbringing, children that are products of my parents will not succeed, will not do well in college. The odds are against you. The stats show that you won't be successful. And I could have taken the road of believing that, and some days I did. But I also proved it wrong. I sought out opportunities. It was harder, but I sought out opportunities. I asked questions. I asked for volunteer experiences and shadowing experiences. I read a lot about the profession. I read a lot about healthcare and medicine. So if there is one thing I can say, never give up. Even if you apply to a PA program and you're not accepted, try again. Look for PA programs who are going to value what you're going to bring, value your lens, value your perspective. Never think you are not good enough. There is a lot of room at this table, and you belong there. There is a seat waiting for you. That's what I would say to you. You know, what first comes to mind, I was raised by my grandmother, and my grandmother passed away in 2009. I received my doctorate 10 years later in 2019. And I remember the first thought was, Grandma, I made it. And I think a lot of it was proving to myself that I was able to achieve a degree at a higher level, at a terminal degree level. And a lot of it was also opening doors for others. With the doctorate degree, I hope to be able to move in administrative roles where I can have more impact in recruiting diverse students, setting environments for inclusivity. But I think a lot of it was proving to myself that I can do it, because I've been told so many times that, well, you got lucky with the bachelor's, you got lucky with the master's. someone in your background that didn't have, private school training and tutors and access to different educational tools, most likely wouldn't survive or be able to earn or achieve a doctorate. And this was just one step in proving to myself and to others that come behind me that you can do. Yeah, that's a really good question. Being a Black female faculty member in the PA profession, we're underrepresented, but there's also a strong community of minority faculty members that have blazed the trail before me, and that there are many coming. Hopefully, I'm helping to sort of issue in or march in, coming behind. I'll share a story with you. Last year during our interview cycle, I was interviewing, and in walked a Black female student. And immediately when she sat down, she began to cry. Tears just began to come down her face. And I was put back because I hadn't even said anything yet other than, I'm Alicia Bowden, welcome to your one-on-one interview. And when she collected herself, she began to apologize. And she said, I'm so sorry. I'm overcome with emotion because this is now my 8th program that I have interviewed at in the last 3 years. And this is the first time a Black female has interviewed me. And just to see what impact that was on her, how meaningful that was to her, she was able to peel back that mask and actually show me who she was, as opposed to trying to overcome these invisible barriers with interviewing as a minority student. And I still remember that because that is why I'm here. I've oftentimes been told or heard, you can't be what you don't see. And I think as a faculty member who is a Black woman, my goal is for Black students to see me and know that they can also be me, or be better than me, actually. That's what I'm pushing them for. And so I take being a faculty member very important. I make sure that I am involved, probably overwhelmingly, and trimming my bandwidth, or thinking about my bandwidth over concerted efforts to make sure that I am involved in committee works. I'm involved in recruitment. I am involved in retention of students, and making them feel valued, making them feel that they belong. I am sharing oftentimes my feelings of imposter syndrome as a faculty member at a PWI, and I share this with the students. I had a student say to me recently, I feel like a fraud. And so me and her had to have a discussion about that. And so I had to share that sometimes I don't feel good enough or smart enough or empowered enough to speak up in the room. And I think it's important for students to understand that, because then they realize this is not just me. This is not that I'm lacking or I'm deficient or I don't belong here. This is a systems problem. And so hopefully I can serve as that, as a vessel for other students, again, like I said, who may not see themselves in the position that I am in. Yes, and I thank PAEA because I have been involved in Project Access for many years, and it is near and dear to my heart. One, because it almost feels like the front lines, right, of getting the information about the profession out to those who need it and who may not otherwise have heard of the profession. I often share with teachers, guidance counselors, career advisors, and also parents that choosing the PA profession single-handedly changed the trajectory of not only my life, but my family's life. Choosing this profession single-handedly stopped the cycle of poverty, stopped the cycle of addiction, and stop the cycle of lack of resources. My son will not know what it's like to live in poverty. And imagine that big deal on top of doing something that I love, giving back to a community that I love. When I see patients who are low socioeconomic status or have low resources, I don't see a burden. I don't see a community that is thrown away. I see my family. I see my uncles, my aunts, my brothers, my sisters, my mom, my dad, and I'm able to relate to them in a way that no one else can. I understand if someone says, well, why don't you just go and buy more fruits and vegetables to help with your diet for diabetes? I can understand that maybe they don't have the money. And oftentimes, if there's a family of 4 or 5, it's cheaper to get a 49-cent burger than to go buy a salad. And so I can brainstorm with them in how we can make better or healthier choices with the limited resources. And so single-handedly, this profession changed my life. And I will never, ever give it up. I will go to my grave, PAC, and I hope that I can inspire many, many others to do the same.
All right. Wow. I'm going to come on camera right now. That was an absolutely amazing video. And I actually want to introduce Heather Storm, who has joined us now. And Heather, I want to say thank you for allowing us the opportunity to hear from Dr. Bolden. I also want to tell everybody where they can find that video, because Health Professions Weeks has great playlists, and I actually pulled up our YouTube channel here where we can see all of those playlists. And so a lot of the video content that you're going to see this month comes from what's available on YouTube. And this is just absolutely an outstanding reference to the quality of videos that our partners provide. And again, I'm excited to introduce Heather Storm from the Physician Assistant Education Association. So welcome. It's nice to have you here today, Heather.
Hi, thank you for having me.
Yes. I will take audience questions. So again, if you're hanging out in the audience and you've got a question, there's a couple of ways that you can get that to us. You can put it into the chat and I'll get that and I'll relay it to Heather. You can also put it in the Q&A box. And again, I'll be able to see those and have Heather answer those questions. I'm going to kick it off though, Heather, and say, Dr. Bolden kind of has an amazing journey to becoming a physician assistant and kind of went above and beyond in order to earn those faculty positions. Can you tell us a little bit more about some of those traditional paths to becoming a physician assistant or the physician assistant with that clinical certification? Talk to us a little bit about that, the education pathway.
Like to become an educator, you mean? Like going from clinician to educator, or you just mean becoming a PA?
Becoming a PA.
Okay, so yeah, as you heard with Dr. Bolden, there's a lot of different pathways, and with the PAs, one of the great attributes of the physician assistant profession is that when you become a PA, it's less schooling and less clinical time and less debt than becoming a physician or a nurse practitioner or something like that. So it's a great path for somebody who is maybe like economically disadvantaged or something like that, because you're going to spend less time racking up debt and you're going to be able to increase your earning potential like right out of school. And it's also a great path for non-traditional students. But for a more traditional pathway, you have to have a bachelor's degree before you can be accepted into PA school. Or there's also programs that we call like 3+2 programs, where you would go into a bachelor's program with the expectation that you spend 3 years earning your bachelor's, and then you would apply again to get into that school's master's program. which is the PA program. So it's 3 years getting your bachelor's and then the 2 years of the PA program. But what most students do is they, as I said, would get their bachelor's degree, and then you spend your time finding your PA program. We have about 282 accredited PA programs right now, so a lot. There are a lot of PA programs, and there's even more in development because the PA program, or the PA profession, is like massively growing right now. One of the things about the PA profession is that when you go into PA school, it's about 27 months of really intense training because it's shorter than med school, because it's shorter than becoming a nurse practitioner, because of all of that. So it's like about a year or so, or a year and a half of what we call didactic training, which is like classroom training, and then like about a year of clinical training, which you get about like 2,000 hours of clinical rotations in different specialties. And those specialties are all in different areas because PAs are trained sort of as medical generalists. So you're trained in everything. And that's because you don't have to choose a specialty before you go into PA school. You actually don't have to choose a specialty really ever until you get a job. So when you graduate, you can go out into the world and choose a specialty when you get a job. You can say you're interested in dermatology, I'm going to take a job in dermatology, work in dermatology for a year, and then say, you know what, I really love dermatology, but now I think I'm interested in pediatrics. And you can switch to pediatrics as easily as just getting a job in pediatrics. So for PAs, it's as simple as just finding a new job. You typically don't need to get additional training or education unless your position requires it, unless your setting that you're working in or your supervisors or whatever require that. Now, obviously, that depends on, if you're switching from something like maybe pediatrics to surgery, then yeah, they might want you to maybe get like an additional fellowship or something. But because you're able to just go out into the world and practice after about 27 months of classroom training and clinical training, PA faculty, PA programs expect you to come into PA school ready to go. So what that means is that you have to have all of your prerequisites. You need to have all those science classes, you need to have all those math classes, you need to have all of those things when you apply to PA school. You need to have direct patient care experience hours, which means most PA programs expect you to have experience working hands-on with patients in some form. So maybe working as a CNA or working as an EMT. And they also maybe want you to have healthcare experience hours, which means maybe working as a medical scribe or working as a medical assistant, or even just working at a hospital as a receptionist and having experience in and around healthcare. They also usually require shadowing hours. So they want you to shadow PAs, and often they also maybe want you to shadow other healthcare practitioners, because questions that you're probably going to receive in interviews is, how do you know that you really want to be a PA? Especially if you're a young student coming straight out of, your undergrad trying to get into PA school. How do you know that it's really PA? Have you considered being a doctor? Have you considered being a nurse? Have you considered being a physical therapist? Have you shadowed those practitioners to know that that's really not what you want to go into? So I think it's important to also shadow those other practitioners. So once you get all of those experience hours, you get all those prerequisites, you get, your recommendation letters and all of those things, you apply to PA school, you hopefully get in. You go through that 27 months of training, you go out in the world, not out in the world yet, right? You do the 27 months of training, you take your PANCE exam, which is the national certification exam, and then you get your license in the state that you plan to practice, and then you go out in the world, you get your job, and you become a PA. So that's the whole scope. For those who are non-traditional, it's similar. I mean, if you have a bachelor's degree, you might have to go back a little bit and make sure that your prerequisites are within a certain time limit. So maybe within 7 years of your application to the PA program. And if it's not, then you might have to retake some of those prerequisites. You might have to get some of those experience hours again. But for most practitioners, or for most students, whether you're non-traditional or a career changer or a student, it's not pretty easy. It's a lot of work. But from what I've seen from all the students that I've worked with, from all the pre-Ps that I've worked with in the whole spectrum, that they're pretty dedicated to going into the profession. So it's usually a lot of things happening at once, but they're pretty sold on getting all those pieces.
Oh, it's exciting. It sounds like such a wonderful career choice. It sounds like something that, students can, research and learn more about. Now, I have a question. You talked about all those hours shadowing and patient experience, and I know we're kind of coming out of COVID. So my question is, how are, a student who is in high school right now who wants to learn more about becoming a PA and some of these, pathways, either the 4-year or those 3-2 programs, how are they going to be able to get those shadowing hours? Do you guys have advice for somebody who is looking to shadow? And again, maybe COVID is, kind of putting some doors up in their way.
Yeah, so I think COVID does make it difficult. I think even prior to COVID, it was always sort of difficult, not even just for PA, I think just in general, because I think a lot of practitioners, a lot of practice settings, hospitals, clinics, they sometimes have, like liability insurance more so than sometimes the practitioners themselves want to take on students to shadow and maybe aren't allowed to because of their setting. The thing that's opened up a bit more has been virtual shadowing, but that's it's sort of like something that you have to be wary of and make sure that you're doing your due diligence for. So there's opportunities to do virtual shadowing, but you need to make sure that the virtual shadowing that you're doing is, I was going to say the right kind, but what does that mean? So there's people that are offering virtual shadowing. A lot of PAs especially are offering virtual shadowing, and even some PA schools. You need to make sure that if you do that, you're not just maybe like watching a video and then like, or even like paying, like if somebody's offering you virtual shadowing, they shouldn't be charging you. Just like if you were doing shadowing in person, like nobody would ever charge you to do shadowing. So you should never have to pay for virtual shadowing or regular shadowing. If you're just watching a video and there's no interaction about the experiences that you're seeing, that's not going to work. A school's not going to accept that. It should be a dialogue. It should be somebody maybe going over a case, like a PA or another practitioner going over a case, asking questions, maybe quizzing you. And you should get like an actual certificate. You should be able to verify those hours with the practitioner. You should be able to go back to a practitioner, somebody who is licensed, and be able to say, like, I shadowed this person. This is the case we went over. These are the questions they asked. You still have to check if schools will accept that. Some schools will accept virtual shadowing, some schools won't. Aside from that, because some schools will only accept some virtual shadowing and also like in companion with in-person. So it might only like mitigate some of the hours you need. For just regular shadowing, you just kind of have to like just do as much as you can. So contact like every like hospital, clinic, anything in your area, see if anybody you know will, or any place will take on like any students, even if it's not like a PA. You might be able to make a connection by shadowing another practitioner. And I think it also, like I said earlier, it isn't a bad thing to have when you go into an interview or you go into something else, to be able to say that you've shadowed other clinicians. But that person also might be able to connect you to a PA to be able to say like, oh, you know, like you shadowed me and I also know a PA to connect you with. If you're in undergrad or if you're in, you know, your master's, if you're going to a school right now, check with their alumni office to see if they can connect you with any medical graduates, any PA graduates. Check with your advising office to see if they can connect you with any graduates or former advisees. And also check with family, like check with any family that knows anybody in medicine. The last option also is social media. So I'm in a lot of pre-PA, PA student, and then like PA practitioner groups where pre-PA like applicants will go in and ask a lot of questions about, you know, the application process, and PA students are in there kind of like giving back because they were pre-PAs and they're asking the same questions. And then obviously when those students graduate, they're still in those groups as clinicians. And a lot of times, you know, they continue helping in those groups. And so when some students ask, you know, hey, is there anybody I can shadow? Those students or those clinicians are still in there and saying like, oh yeah, I'm in, you know, Texas, I can take somebody. So joining those groups are a good way to maybe put yourself out there and say like, hey, I need somebody to shadow. Is there anyone here? And somebody might be able to take you there as well. So.
Oh, I love that. That's a great community and a great suggestion to connect with folks that are out there. And obviously, if they're on social media and they've got an Instagram account, you know, that they want to connect and they want to give you the best piece of information that they possibly can. Okay, Heather, okay. So first of all, last call from those of you in the audience. If you've got a question that you want to get to Heather, put it in the chat or put it in the Q&A box right now. Other than that, Heather, I'm going to say this is my last question. So you've hit on a lot about what types of patients PAs treat and where they work, but kind of give me your big 30,000 foot answer about where can you find PAs, you know, where do they work and the types of patients that they treat.
PAs work everywhere. So anywhere that you would find a physician, you can find a PA. And anywhere that you would find patients, you would find a PA. So that's the highest level answer I can give you. PAs work in every medical setting. They work in every specialty and every medical subspecialty, and they work especially well in filling gaps in healthcare and in, you know, like patient care. There's, you know, a physician shortage, and being able to fill those gaps with, you know, team-based practices, with PAs, with NPs, with you know, like just healthcare, full rounded healthcare teams. You know, PAs are able to help do that. And, you know, PAs are able to do pretty much everything that your primary care physician can do. You know, PAs can write prescriptions, PAs can be first assist in surgery. So, you know, it's a whole spectrum of things that PAs are able to do. So you can find them everywhere. You can find them doing anything.
Awesome. I love that answer. Heather, thank you so much. Thank you for being here, for answering our questions, for providing us with that amazing video that we got to see, and all of the resources that you help with Health Professions Week. So I appreciate you being here with us. Thank you to the audience who's watching live, or if you're watching on demand. If you have on-demand questions, put them in the chat box. We'll get them, and I'll get them to Heather after the session. Thanks so much, Heather. We'll talk to you soon.
Thank you.